Hi, my name is Narada Immaculate, and I'll be doing a colostomy care skills video. Um, First, I gather my supply. I have my container, and then I have my patient. I have my ostomy base plate. I have my pencil. I have my scissors, and then I have my stomach guide. I have my barrier cream that I use to prevent for skin integrity, and I also have my hand hygiene and my gloves and my towels. So with this skills video, I'm going to be showing you how to change uh, a stomach bag from a patient. So first of all, I knock on the door, and then I come in. I provide for privacy. I introduce myself to my patient. Hi, my name is Naranda Immaculate. And after introducing myself, um, hi, my name is Narada Immaculate, and I'll be your nurse providing care today. Your doctor or your provider, your health provider ordered that we do a stomach bag change on you. So after that, I then verify with two identifiers. I ask my patient to what's their first and last name and their date of birth, and they tell me. After they tell me, I check on the wristband just to verify if it's the patient that I'm going to work on, and then after that, I explain the procedure to them, what I'm going to be doing. Your health provider ordered to have me change your stomach bag. So after that, then I'll go and hand sanitize or perform hygiene. After performing hygiene, I'll then get my normal gloves and apply them, put them on. After I have applied my gloves, I then in this case, um, as you can see, my patient, I have to first position my patient in a very comfortable position so I can be able to perform the procedure well. So I position my patient. They have an old stomach bag on them with an ostomy baseline plate attached to them. So what I do, I then empty the disposal. I empty and dispose of the pouch. So this is the stomach bag. I get it, and then I empty it in my container. After that, I either dispose it off, and in this case, I'm going to keep it, but I can trash it. And then after that, I have disposed of my pouch and in the trash. I then remove the appliance ring. If you can see this, the base plate on my patient, and this is the stomach. So I make sure that I am very careful. I don't injure my or I don't damage my patient's skin. So I'm able to look at the skin, and then I start from one of these sides and these sides. Make sure that I'm careful, this side and this side, and then take it off gently. After I've taken it off, again, I dispose it off. But in this case, I'll maintain it because it's the only one that I have in this case. After I have disposed it off, I've removed everything, then I get my cloth. And then after getting my cloth, I, I put my cloth in water or a solution that is accepted. And then after I assess, because I'm at this time I'm going to clean up my around the areas of my stomach. As I'm cleaning up, I assess my stomach to look at any skin integrity, any skin damage, any kind of redness, and in this case, any kind of blood, little blood is okay, but then too much blood is not okay. I have to report that to the service provider. And after I've done that, I then dispose of my towel, and then I get another towel that I'm going to use to dry the area. So I dry the area while still assessing the stomach for any skin integrity, for any dryness, for any redness, anything that doesn't look normal. And then after that, I dispose of my other towel. So after disposing of my towel, I've assessed my stomach. I've assessed my stomach, and I'm very satisfied that actually the area looks fair. Oh, okay. Then I dispose of my gloves at this stage. So after disposing of my gloves, I then perform hand hygiene. After performing hand hygiene, I then I then measure. But I measure my stomach guide, my stomach, the centimeters, or the area, the circumference of my stomach. So in this case, I have my stomach guide, which I was provided with. So I try to, so I already cut my stomach guide in this, as you can see. So after that, I try to see which can actually fit. It doesn't have to be very tight onto my stomach, and then it doesn't have to expose a very big part of my stomach. So I have a 38, a 41 looks big, a 38 looks okay, but quite, but let's try a 35. So in this, the 35 kind of fits well, so I can see my stomach. I can be able to So after that, I perform hand hygiene. I put on my gloves. So we're going to use another plate. So usually the plate is already sealed up in a stomach base plate. Then I get a new plate from there. Mine has already been cut off. Then after that, I get my stomach guide. Remember, we selected a 35, and then I press my stomach plate under, and then get my pencil and then measure it. So this will be my circumference that I'm going to use. After that, I pick up my scissors and then cut that part. After I've cut that part, I then get I peel off. In this tent, I peel off my But remember, before I actually attach my stomach plate onto my stomach, my patient's stomach, after I've peeled off, I have to get I have to apply skin barrier onto the skin so I can be able to protect the skin from any skin integrity, or I have to assess for any skin integrity, and then also to protect the skin for any barriers. So it's kind of like a cream that you put first before you can actually attach the stomach plate. So the skin doesn't really affect the skin or cause skin breakage. So I've removed my um, as you can see, I've removed my and then after I press it on my stomach area. So after I've pressed it on my stomach area and I'm able to see my stomach out, I bring again my stomach bag, a new bag, and then but like we say, we only have one bag, so I attach it and I make sure that I can hear it click. That way I know that it has been fully attached, or it won't be able to fall off my. But I make sure that I don't press it so hard, so I don't hurt my. Sorry, I don't hurt my patient. So I've been able to successfully uh, put the stomach bag onto my patient. Then I fold it so it doesn't leak, so I can be able to prevent any leakage. And then I tighten this part down so it doesn't leak. But remember, before that, when I was asking my patient, I asked if they have any allergies, skin allergies, and my patient said they don't have any skin allergies. So I went ahead and did the procedure. It is very important to ask for skin allergies so you get to know if the procedure actually works well with the patient. So I'm done with tightening it so it doesn't leak. So after that, at that stage, I ask my patient if they're okay, uh, and then I also reposition them again into a comfortable position that they feel that they are comfortable. So after I've done that, I thank my patient. Thank you for allowing me to do this procedure. After thanking my patient, I then um, I do what I take off my gloves. I'm done with I've completed the wound assessment and provided ostomy care for my as per my facility that has told me to do that. So after that, after I've thanked the patient, I've done the assessment, I've done everything and the procedure. So I again perform hand hygiene. It's very important to perform hand hygiene. After performing hand hygiene, I clean up the place, make it safe for my patient. I give my patient a call light, so in case they need help, they can always call. And then after that, I then document my procedure and communicate any concerns to the patient's provider. Thank you so much.